Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications which are sometimes overlooked. So overall, we hope that by watching the video diary program you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name is Joyce and I was born in Loughborough and eventually married Dave, where we had two girls, one Mandy and one Tracy, and we're a very happy family. And as they grow up we had a business. Dave went to the building and we had a building business which was very successful. And then as the girls grow up, they studied hard at school and I sort of encouraged them, you know, really work hard and do something with your life. So eventually they took all their exams and they got very, very good results. And Tracy, she went into tourism and she went to Spain to work. And my other daughter was still at school, Mandy. And I think Tracy was a little bit of a carrot for her. So Mandy followed suit and she went into aerostessing, which she worked down London and she came home quite regularly. Then she got a job with Gulf Air, where she went to Bahrain to work, where she now resides in Bahrain. And Tracy carried on with her tourism work and she met her husband and she now lives in Egypt. She's been there, she met her husband there and she's been there about, let's say 19 years now, and she has a 16-year-old son. And it really opened up a real new life for us because the travelling side, the holidays were absolutely fantastic. Although I'd lost my two daughters, I felt as though we just had this fantastic life of travelling around the world with them. And I say now they still come home regularly to see us and we go to see them, which is very nice. And then, to say, everything was going really well, although I'd never really enjoyed good health, what with indigestion. But I used to take the old tablets and the medicine and keep it at bay, until as the years went by, it actually really got on top of me, where I really did start to feel really poorly. But each diagnosis was acid indigestion or hiatus hernia. And anyway, one day I was really poorly sick with it, and of course the sickness got worse. And then the two girls came home, and they both came home together. And I said, "Oh, Mum, you're so ill, you look so ill." Oh, it's just my indigestion playing up and one thing and another. And they both insisted that I should further it. But me being me, I didn't want to know. I was just bury my head in the sand, as they say. But eventually I was so poorly, I did have to go to A&E, where a very kind doctor there, very young, he said, "Joyce, please further it." Which I thought, well, I've come to the stage now where I have to, because I was becoming a worry to the girls with them being abroad, and which is the last thing you want to be to your children. But anyway, I did, I furthered it. And I decided to have the scan. And I went along for the scan, quite happy really in myself, thinking, well, if this is hiatus hernia or indigestion, they're going to be able to do something for me and, you know, get my life nice again, because I got to the stage where I couldn't eat anything, and I was eating ridiculous little things to keep going. And of course they took the scan, and my husband was with me, and the diagnosis wasn't good. And we knew it wasn't, because there was a bit of a kerfuffle and they stopped doing it. And the next thing, I was on the ward, and I was in hospital for a week with various doctors and nurses coming to check me. And the strange thing about it is they keep it from you right to the last diagnosis. And then you're sort of hit with it. You know, I'm afraid it's not good news, Mrs. Bottomley. It's cancer.
So Joyce, thanks for joining us today on the video diary programme. Appreciate you spending this time with us. Not many people have come in to tell us about stomach cancers, so it's very valuable that you have come to share your experience.
Yeah.
I don't know much about your situation, so let's start from the beginning, if it's okay with you. How was the cancer picked up in your case?
Well, as I said before, I'd suffered with a lot of indigestion, which over the years it got worse really. I was taking more medication, more tablets. And the doctors were sort of prescribing, oh, it's acid indigestion, hiatus hernia, because previously I had a gallstone operation where they said that may have weakened the stomach. But in between there was a mention of, you know, would you go to the hospital, Joyce, and have it furthered? But at that time the tablets were working, so I was quite happy, burying my head in the sands, thinking another tablet is gone. But as I said, as the years progressed, it got very severe. The symptoms got worse and worse, where I wasn't coping with them. And of course, my eating side, I was eating practically anything, living on really such things as fried potatoes, fried tomatoes. As for vegetables and things, no, it was a no-no.
So there were certain things basically that were out for you?
Oh, definitely, yes. They agitated it. I had to be ever so careful and I couldn't drink a fizzy drink. I never drank a wine or anything, because all those type of things agitated it and made it worse. So I just, well, it became my life really to avoid all these things and just basically live on the little bits that I could digest, and a load of tablets and acid and indigestion.
And what was happening to your weight over this time?
Well, I was about 8 stone 5, say, and it was going down. When it got really bad, I was going down, because I was literally, horrible to say, but literally vomiting everything up in the end.
I see, so that was an additional symptom.
Yes, it was a real bad one towards the end. So I know in my own mind, you know.
When you eventually went to the hospital, do you remember what test it was that revealed the diagnosis?
Yes, I had, say, the young doctor persuaded me, please make the appointment and go, Joyce, because I think he got a vague idea it was a lot worse than the indigestion. So I went along for, I think it's called an endoscope.
Yes, endoscopy, yeah.
Yes, and my husband was with me. Of course, they took me into the room, and I think I had a slight injection to make me a bit woozy, because the thought of it was, oh, you know, horrible. And I say they put the endoscope round, because my husband was at the side of me and he knew more than me, because the next thing, because the next thing was basically, oh, stop, 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 you know, and they knew there was something there that if they went any further it would probably cause trouble, like. And I think another doctor came into the room and everything, and then we went outside, and next thing I was on the ward.
was the diagnosis given to you on the ward?
After about a week.
And not till a week later?
No, I had a lot of, they come to see you and they take this test, that test, all sorts of things. And because you do say to them, is it serious? And go, oh, no, don't worry, don't worry. But although you're thinking to yourself, please don't let it be anything bad, I think deep down, you know. And I think at that time I had an hemorrhage. I had a really, really bad hemorrhage. I lost, I think it was about, 8 pints of blood or something, a real lot. And I was on drip and wires and all sorts. And then, of course, the final blow came that it was cancer.
So you really had a tough time around the diagnosis?
Yes, we did really. It was.
When they revealed the diagnosis, did they have additional information about how it had progressed or how severe it was at that stage? Well,
it was quite bad because I think it had attacked a few of the other little organs as well. Although the main cancer was in my stomach, it had attacked a few little bits and pieces around it. And Dr. Ann Thomas, she was absolutely marvellous. She's my oncologist. And we had a little meeting in the room with her. My daughter had flew over from Bahrain. So the three of us went into the room. And, of course, I was just told, you've got cancer of the stomach, Joyce. And, I sat there. We were all initially in shock. And, because my first thought was, can you operate? Because that's what you think. Operate, get it out, get it away. And, of course, the answer was no, which was another shock.
So in your case, it was inoperable?
Inoperable.
Yes.
Yes, yeah.
That's probably the extent that it was there at the time.
Yes. And of course, with all the little bits and pieces that it had sort of spread to, and of course you're in a bit of a state, you can't really, connect to it. But I was offered chemo, but I was offered to go on the trials to start with. But I had everything going for me for the trials, and then out of the blue, they found out I got tinnitus and tinnitus, and that was the one thing that stopped me going on the trials. And then, as I say, they offered me chemo. A few weeks went by where I was really panicking because nothing was happening. I hadn't heard anything, and I thought, oh God, they put me on the scrap heap, And of course, the last thing they said to me when I left hospital was, Joyce, we're so sorry. Just go and enjoy the rest of your life. I thought, oh my God, it's a death sentence. But anyway, I started my chemo, and it just wouldn't shrink every time I went back. And I had like a bottle on my arm, which was 24/7. It was a very fierce chemo, but it just wouldn't shrink. It stabilised, but it wouldn't shrink. So we were just left with this lodger, as we called it then, just sitting there, not growing, but not shrinking, which was a little bit harrowing to, cope with. But
did anything else attack it, in terms of the treatment? Did they offer you some other alternative that did start to work?
Well, I was in and out of hospital, still with sickness, really poorly. And my oncologist came to see me. I was supposed to go to the hospital to visit her, but with me being in hospital, she had to come to visit me. And she said, Joyce, she said, Dr. Barry has offered to go in your stomach and give you a biopsy to just check what's going on inside. She said, do you agree to it? And I thought, well, where do I go? There's nowhere else to go. So I said yes, because he said all he's out for is to prolong your life, give you, a nice life. So I said yes, I'll do it. So I came out of hospital, then went in, I don't know how long it was, probably 2 weeks later, and Dr. Barry did the laparoscopy, did that for me. And I was in hospital, and it was very harrowing. It was really like a roller coaster ride we were on. It came into me, it was about 8 o'clock in the morning, and my husband was visiting, and he just said to me, Joyce, there's nothing we can do. I went, oh my God, and next thing my husband walked in, and I just said, Dave, I've had it. Then, of course, Dr. Barry says, but we'll wait for the results. They're very premature at times. Anyway, the results came, and it wasn't quite so bad. So he said, I'm going to go in and I'm going to operate. Because I was in a complete flood of tears. I thought I'd be laughing, you know, jumping up and down, but I think it was the roller coaster ride we'd been on. It was like a climax.
I can see that, because quite a few times you'd been told, you know, there isn't a lot for us to do.
That's right.
That's not what anyone wants to hear.
No, oh, it's terrible.
But at the end of the day, almost at the 11th hour, it sounds, they came up with the option for surgery, even though you'd previously been told it was inoperable.
That's right, yes.
So the surgery then went ahead. How did it turn out in the end?
Well, it turned out wonderful, as I say, because my husband was with me and Mandy at the time, and they said to Dr. Barry, because he said it was a very dangerous operation, because at the time I was, I think I was 66, and he basically said, not many people get over it, and I have to go in, and he said, put my hand inside to feel the pancreas, because the pancreas is a very bad cancer. And he said, if there's anything there, you know, I stitch you straight back up. I'm sitting there thinking, oh my God, you know, what do I do? Anyway, Dave said, which way do we go? He says, no way. This is the only way you can go. You've got to let me go in and, you know, do my best. But one of the funny things was, Mandy and Dave are very inquisitive. And of course, Dave was saying, can you explain what you're doing, Dr. Barry? But can you explain it in a plumbing way? Because my husband's a builder. And there's Dr. Barry saying, I'm going to cut this back. And I'm thinking, God, this is not a plumbing job. This is my stomach. But anyway, we came out, and I thought to be really over the moon, but I was so depressed thinking that, you know, it had come to that. But anyway, I had the operation. And Dave and Mandy stayed all the while. I was down the operating theatre. And I remember coming round, and the first thing I did was look for wires and things. And I saw all these wires and tubes, and I thought, oh, God, he has done something. And of course, the next thing, Mandy, I think she grabbed him, and she said, you know, is it a success? And it was.
It was. How was that judged? Based on the fact that you continued to improve after that point?
Yes, I mean, I was quite rough after it, because they do give you this epidural, which actually freezes the whole of your body. So you've got no pain, no nothing. You just completely froze, and of course they're coming around all the while, putting ice on your tummy to, you know, make sure your feeling's not coming back, which was wonderful. But of course, when they take the epidural out, you're thrown into this terrible pain. It's really awful. Yes. But we cope with it, and you know, you just really have to get on with it, because you're so thankful that being given a chance.
Yes. Later, did he give you any more information about how successful the operation was, what he took away, and if anything was left?
Well, he did say the small bits had gone dormant, and that was why he was able to operate. So whether not dormant, that's the wrong word, isn't it?
In remission, they disappeared? Or?
They sort of disappeared, haven't they? I think the actual chemo had cured the little bits floating about.
Yes. That's interesting what you were saying about the operation. Later, did they give you further information on how much they'd taken away and how successful it was?
Yeah, there was 70% of the stomach that Dr. Barry took out, and 22 of lymph nodes and the surrounding area. Yeah. So I'm left with, would it be 2/3? I'm left with a third. I'm left with, which enables me now to eat and.
Well, that's a big question, isn't it? What was the adaptation that you had to make after the procedure to get back to your lifestyle? Were there certain changes?
Well, at first, I mean, the week in hospital, I couldn't eat anything, couldn't drink, eat anything, because, you know, they've got to allow the stomach to heal inside and, you know, get strong enough to accept the food. So I was very fortunate, really, because I did eat. I could eat. Quite soon after the operation.
Given that your appetite and eating pattern had been restricted before because of the symptoms that were known to be part of the cancer, was there then a difference, meaning that you could suddenly eat things that previously were restricted?
Yeah.
What did you notice?
Oh, everything. It was absolutely marvellous. I could drink wine, which I do have the odd glass of wine now. I could drink fizzy drink, and everything that I had to leave off. Vegetables. I mean, I used to eat the dietitian I was involved with, she used to laugh because I used to put 6 peas on my plate. That's all I could eat, 6 peas, a few potatoes. Yeah. And now I'm eating everything, so broccoli.
Basically, all those restrictions were lifted?
Yes, every restriction was lifted.
Although, is there any area which you're still cautious about?
Well, you have a thing, it's a horrible thing to say really, but you have a thing called dump when you've had the operation. And sometimes you can eat broccoli, then the next time it does affect you and you have this awful dump where you have to go toilet, you've got no choice.
Yes, I think they call it dumping syndrome.
That's right, yes.
The food is passed through without being properly processed.
Yes, that's right.
And then it's a little bit uncomfortable at times.
Yes, and it's very strange because like I've just said, you can go and say eat cauliflower one day and then a month later that cauliflower doesn't suit you and a dump. Okay. And it's not nice, it's not a nice thing because you're not really in control of it. Yes. I mean, we have to laugh about it sometimes because we're out and Dave has to put his toe down sometimes to get me home, you know. It's not nice, but it's a small price to pay.
I follow that.
You know, for what you've been through.
What was the next step for you after the surgery was completed? It was a success by all accounts.
Yes, I mean, it takes you a little while to get back on your feet and, you know, there's a lot of things you really are restricted to doing because the stomach does feel as though they've been inside it, you know, during the operation. And Mandy was with me at the time. She came home and she was doing the majority of the housework for me because you really are restricted what you can do. So it was a slow period getting back to jobs. I mean, even now I can't do what I did before the surgery, but once again, it's a small price to pay.
So you've been gradually getting your strength back?
Yes, yes.
How much back to your normal self would you say you've come to?
Oh, I'd say I was a good 80. But then again, my age, I mean, I am blaming it on the operation a lot, but maybe my age. I mean, I'm 73, so probably a lot of these restrictions and aches and pains on my age, not the actual operation.
Were there any subsequent complications for you, things that interfered with your improvement?
No. And the funny thing was, before the operation, I had very, very high blood pressure. I was on probably, I don't know how many tablets a day. And after the operation, I had low blood pressure where they were coming to me about every hour to try and get my blood pressure up. And from that day, I've never had blood pressure.
It's normalised now, has it?
Yes, and nobody can give me an answer why. Because I'll say, well, why don't I get it now? And there's no answer. I think I had real good blood when I had the blood transfusion. Probably someone with no blood pressure.
Was your weight low when your blood pressure was high? Or was your weight above normal?
Well, my weight was very low. I mean, I was under 8 stone before the operation because with all the sickness I'd lost so much weight. But when I came out of hospital and got eating again, I mean, my weight just crept up. And I mean, now I'm over 11 stone. Never been this in my life, but I've never eaten like I eat now, so.
It might have something to do with being at a healthy weight now.
Yes.
Blood pressure's normalised.
Yeah, probably.
So you were mentioning about the support. So let's talk about the support that you had around this time, and also going forward when you were back home, you know, recovering and trying to get back to your normal life routine. So what supports were there and important to you?
Well, I mean, there was a lot of support out there, and when it was at a very bad stage where, you know, there's nothing they could do, the Macmillan nurses, you know, stepped in. But I had Mandy at home and my husband, and they were absolutely wonderful, and they were my support. Yes. And of course, as soon as I had the operation, the Macmillan nurses stepped back because, you know, I didn't need them anymore.
So you had good family support then?
Good family support. And when my younger daughter nipped home, my other daughter came when she could. because she got the boy and she was married, so it was a bit more difficult. But she came home when she could, and the family support was all I needed.
Yes. Did you find you needed any additional help from any healthcare professional, or other patients sometimes can be valuable, or other source of information?
No, none at all, no. But we just got on it in our own little way. And like I say, previous to the, not being able to do anything, we had to make a lot of fun out of it to get through it.
Well, you were telling me earlier about how you treated the cancer as an entity and the terms you used. Why don't you tell the viewers what you told me earlier about that?
Yeah, well, I say after the initial word cancer, it was horrible. It seemed so final, and we felt that way. God, it's such a final word. So we renamed it, and we renamed it the lodger. And we said, it's there, long as it behaves itself, pays its rent, has no wild parties, it can stay. And we joked about it like that. And so, of course, all my friends and relatives, it became the lodger to them. And how's the lodger, Joyce? How's the lodger? And although it was a very, very worrying time, at the same time, we tried to make it a little bit funny to get through it.
So in a way, you used a term that was acceptable to everyone.
That's right,
and then other people may have felt more comfortable raising it with you.
Yes, definitely.
They could see you weren't so distressed by that term cancer because you weren't using that.
That's right, that's
so
right.
That became a kind of tool
yes.
to have a good sort of communication with family and friends.
Definitely, definitely. Because I think for anyone to use that word is horrible. And I think they're afraid of it because they don't understand it. There's only people like myself and Heather and, that have been through it that really do understand it. So to have the little bit of funny side into it, it really did help.
Was that part of your personality to see the funny side of things?
I think so, yes, I think so. I mean, I cope with life a lot like that now. I had to. And then, of course, the hair loss. I mean, you've got this big bald head that, oh my goodness. So we had this wig. She became Emily. She had a name. And of course we used to joke about Emily. On a rainy day we had to cover her up. On a windy day we had to hang on to her because, oh God, she's going, And then of course you'd meet your friends in supermarkets and you were terrified of them hugging you in case they knocked Emily off. So even Emily became, a joke to us. And probably sounds very strange, but
it's nice to have a light-hearted way.
It was the way we coped with it. It really was.
It's nice to have a light-hearted way.
But there is one little bit, of advice I would say to people. Please get a wig before you lose your hair, because it's going to fall out. You're told it's going to fall out. And you go along, we went along to the hospital because they'd started doing them. And it's like the lady said, while you've still got your hair, I can give you a wig that's very much like your own hair. Yes. So, once your hair's gone, you pop on Emily and it was like my own hair again. And so quite a few people never knew it wasn't my hair.
You're describing a kind of matching between what they can supply and what you had
Yes,
before.
Yeah.
And in your case, it was pretty good.
Exactly. And as I say, when I took it off, and I looked in the mirror, God, I was a cancer patient with this bald head. But once Emily was on, I wasn't. I was Joyce again. But I do think it's important to get this hair before you lose your own.
How did you feel when you took the wig off?
Horrible. Horrible. I was cancer.
Did you ever get used to that view,
no,
that look?
Never. Hated it. In fact, I used to sleep in a buff at night. And I never took this buff off. And it was the red hot summer because I just thought, oh God, if the house set on fire, I'm not running out with a bald head. No, this bald head was my fear. Yeah. And I was this cancer patient. It was horrible.
It was almost a symbol of being unwell too.
Definitely.
Looking like that.
Definitely. But when I popped Emily on, I was Joyce again, the well Joyce,
And you could go out and socialise as normal.
Exactly, yes. Yeah, and with it being so much like my own hairstyle, nobody really knew that it was a wig. In fact, one lady asked me what shampoo I used. She said, your hair's so beautiful, Joyce. And of course I joked and said, well, it's not mine, And then we had another little funny incident. Went to the hospital and there sat a lady and we're waiting to go for a scan. And there sat a lady in the same wig. We were like twins. So everything about it had to become... a joke.
You must have made a good choice if it was getting popular.
I know. Yeah.
How did you find family and friends responded to your diagnosis?
I think it's very hard because people say to you, fight it, don't worry, fight it, you'll get over it. But they don't know. They don't know this side. It's very easy. I've done it myself. I mean, I've said to people, when the summer comes, you'll feel better. But you do say the most stupidest things to people. But until you're going through this horrible illness, nobody understands. So they're very kind in what they're saying, don't get me wrong, but they don't understand.
You're flagging up the mental side, the psychological side.
Yes, it's terrible.
Is very important.
Very, very important, yes. And I think in some respects, it's worse than actually getting over the operation because it's always there. And I mean, now, I go a little bit weepy, even talking about it after all these years. It's always with you.
The thing is, when you're recovering from the operation, most of the time your body does improve steadily.
Oh yes, definitely.
Whereas with the emotional and psychological side, that can be very variable.
Yeah.
And of course, nobody can give you a guarantee that there's going to be no problem in the future.
No,
so it causes a lingering anxiety, doesn't it?
Definitely. I mean, I was saying to Heather earlier on, even Coronation Street, the soap's portraying it. And of course, the one at the moment is pancreatitis, which we had the same treatment as Paul Haley's having, and I was in a flood of tears. After all these years, it still reduces you to tears. It's very, very strong in the mind still.
And there are these reminders, aren't there, on the TV news a lot these days?
Yeah.
When you see those reminders, do you think, that's kind of me, I identify with that? Or do you think, I've put that behind me now and, I've moved on from the cancer?
No. Always reminds me, always. Although I feel sad I do react that way because I've been very fortunate that, I'm cured and I've had a good few years since I had the operation, but it still affects me. It still affects me very strong.
It was 2006, I think, that you went through most of this.
Yes.
And it's 2013 now.
Yes.
Time's moved on, but how much do you think that time factor has been influential in helping your improvement? Doing normal things again, getting back into routine.
Oh yes, definitely.
It's important.
Yes, definitely. You've got to, I mean, as soon as I felt well enough, we went on little coach trips, and because we've got a couple of friends that we do it with, and I mean, I still got Emily on when we were on one of our coach trips, So you've got to get back into life. You've got to meet yourself.
You were trying to actually get back into normal routine.
Yeah, definitely.
And did you have a routine then, or did you have to remake it? Because sometimes when you've had a setback, some of the things you liked to do previously, you can't get back to that easily. And sometimes you have to think of new things to do. What happened in your case?
Well, I think I was quite fortunate, really, because I hadn't really done anything exceptional. I wasn't a sporty person or anything like that. I was just an ordinary housewife, mother, that enjoyed our little trips out all the while. And of course, our shopping trips and things like that. And we gradually ebbed into them and got back to normal because there's no other way. You got to. It's no good sitting there thinking, "Oh, I've had cancer," and all this. You have to really get on with it and make yourself as normal as possible.
Was there anything you did during that period that stood out to you as symbolic of the fact that you were improving? If you see what I mean.
I think it was the actual going on holiday again, and
a holiday.
Yeah, and I mean, managing to get up a few stairs and things like that, because the things that you're really restricted to when you have the operation. So it's a very slow progress, and then all of a sudden one day you think, God, I know I'm never going to be back to normal, but I'm almost there.
Yes.
So
was it almost like you'd forgotten about the cancer for a little while?
Oh yes.
And then it came back to you, and it was almost like a surprise. You weren't thinking about it.
I mean, the psychological side is not there all the while, It's only things that trigger it off. You know, like a dear friend will get it and you think, oh dear, you know, and then you flash back. The same as Hayley on Coronation Street. You know, I thought, oh, it'd be really interesting to watch, but it really did, you know, upset me, and I think, God, I didn't realise, you know, I was still affected by it to that extent. But it's only the momentary, and then, you know, you
move on.
You move on.
Did you come across any particular patients, maybe going through a similar journey to you, who were you identified with, real patients who were in the system?
Well, not really, because the little crowd that we used to meet at the oncology for the chemo, because I used to have to go, I think it was once every 3 weeks, they'd mainly got esophagus, where I think I was the only one with the stomach cancer.
Yeah, yours is not as common, is it, really?
No,
so
no.
You probably don't come across that many people.
That's right. I mean, they call me the miracle now, the doctor, and even Dr. Barry calls me his miracle. But it was mainly the esophagus that people had got.
But I do know that you then went to a support group, which was meeting about every 3 months.
Yeah.
How did you find that? Because you were introduced to a lot of people there.
Yeah, yeah. Well, at first, I think Kathy rang me up to say, would we go like? And I was a bit reluctant at first, because I thought, oh, do I want to go back into that world? Because it is the cancer world again, or the lodger world. And I thought, you know, do I want to go into it again? And because my husband said, well, give it a try, might do you some good. And of course we went along. And it was really nice. Although there was some really poorly people there, we still had laughs. And Dr. Barry was there, and my 2 nurses. And although I was discharged from the hospital, I still felt under the umbrella again, because they all said, you know, any problem, Joyce, you know, you ring us. You don't go through all this procedure, the doctor, you come straight to us. So that was nice. And you do get a lot of brave people that, you know, stand up and say, oh, I've got this symptom after the operation, I've got this. And you do tend to think, oh, has it really gone? And Dr. Barry will say, reassure you by saying, well, what you've got now, you've got for the rest of your life. And yes, that is normal. So you do come out feeling very reassured that you've learned a little bit from someone that's probably not as far through it as I am, but...
Yeah. And maybe you were providing some input and inspiration for them as well.
Well, I mean, the only thing, as I say, was telling Heather, Kathy did say to us the last time we went, you know, they needed someone to actually, you know, talk about their experience. And of course she was looking at me, because she always says, I'm this miracle. And, you know, I said to Dave, what do I do? He said, have a go, love. So of course I went up to Kathy and I said, I'd be willing, because you feel you've had such a lot of help and support. You want to give that little bit back to try and help someone else. So yeah. That's where this stemmed from, you know.
That's great. I mean, we really appreciate that, and I'm sure the viewers do as well. Let's talk a little bit more about what you found helpful during the recovery and rehabilitation period. One of the things I think you said was you were keeping a note or journal of what was happening, and you brought the journal today, I think.
Yes.
How did you come about that idea?
Well, I think there's so much going through your mind, and you don't want to remember it. It's the last thing you really want to remember, but in a funny sort of way, you do want to remember it. So I thought, well, if I put it down, it's helping to get it out my system. And as I say, before I was diagnosed, I was a very big reader. I used to read a lot of books, the Daniel Steele novels and things like that. And I never read again. I just put this book down and that was it. I never read again. And then one day I thought, I'm going to put it down on paper. And I started writing from the day that, you know, I was diagnosed right through to basically what I'm like now. And I found it a great help. And 1 or 2 people have read it, they've said the same, you know, this is wonderful, I wish I'd have done it. Because although you don't want to go back to it, but I think in my case, with it having a nice happy ending, it is nice to look back and think, oh my God, did that happen? Did I go through that? And I'm still here, you know, so.
Well, it can be easy to forget how much you've been through in a short period of time.
Yeah, yeah.
So did you know, various patients have actually written their experience into books, you know, their whole story?
No, I never knew anyone that had done it.
Yeah,
no
so
one.
They're available if
because I think, like I say, you either get this scary bit where I don't want to be associated with it anymore. I've had enough of it. And I think each individual copes with it in their own way.
Yeah.
You know, and I found with this, I don't know, it helped. I know it sounds silly, but...
We also have our own written program which supplements the video diary, which we're putting together right now, which is basically a brief synopsis of what people have been through. So it's interesting that you came across that spontaneously and you found it helpful.
Yeah, yeah.
And other people also said that it was helpful as well.
Yes, yeah.
Another thing you were saying was about certain plants in the garden being, if you like, symbolic of the cancer.
Yeah.
What was that?
Well, I think a lot of it's to do with the chemo, because I really do think the chemo gets in your brain and you tend to exaggerate everything that's going off. I mean, my husband had only got to go for a paper and my God, he'd gone, where's he gone, you know? And if he was 5 minutes late or anything, everything had concocted, you know, in my mind. And we had this plant in the garden, we called it a Schumacher. It was with very large red cones, most beautiful plant you can have, and it grows into a tree. But it also lets off little tiny shoots, and these little shoots are everywhere in the garden. Everywhere you look there's one growing. And I used to get my daughter up, she was with me at the time, going through this, you know, horrible journey, and I used to get her up to pull these up, because I just related it to my stomach, that this horrible cancer was like these Schumacher plants just shooting up anywhere. And so this plant became a nightmare to me. And I think to my daughter as well.
Did you manage to keep it in check during that time?
Well, we did, because Mandy kept pulling them up. Because with having the chemo on my arm, you couldn't go in the garden. You were very, you know, susceptible to cuts and grazes and bites. You had to be very, very careful with, you know, getting infections in that. So I couldn't pull them up, so poor Mandy had to go out and Dave pull them up. But it was an absolute nightmare to me. But I think it was all, I don't know, the chemo, it probably does things to your head, I don't know, but...
Let's come up to date now on how you're getting on now. What do you see for yourself in the future? Are you making any plans right now?
Well, as I say, we've just built a 2-storey extension. Well, the builder and a lot of help from my husband and various trades like. And we've got our little bungalow downstairs now for when we can't climb the stairs, and there's room there for my girls when they come home. And we're just going to have the little holidays that we've always had, the little coach holidays, and hopefully go to see the girls. And really, I'm just grateful for every day that, you know, we go out a lot. We very rarely waste a day, even if it's only nipping into Loughborough, you know, the town. We just don't waste a day.
Well, that's good to hear.
But there is one place where I do really like to go, and it's the monastery. And I go there and find a little bit of solace. We love that place.
Why is that?
The monastery. It's in Copt Oak.
Oh, I see.
It's, you know, where the monks live, and it's so wonderful. And I'm not a religious person, and I blame God a lot when it happened, but I do find this monastery is so sparse, and I just find solace there. It's lovely. But say each day we try to do something, and that's the way and of course Dave's retired, and really we're old age pensioners, and the time's our own, which is wonderful.
How do you think you've coped overall with this whole cancer journey?
I think I coped well, really, but I had a lot of support.
Yes.
And this is what you need. I mean, I grieve for people that are on their own. It must be a terrible, terrible thing, you know, if they've got no one. I mean, I was fortunate. I had a wonderful family. Well,
this is where healthcare services need to step up and provide input for those that are on their own, or the voluntary sector as well, and other source of support. Which can be put in, you know, if somebody feels isolated, let's say. That's
right, because there must be an awful lot. Well, we had one chappie in the oncology ward with us. Well, we had 2 actually, and both their wives had died of cancer, and there they were with it. You know, so other than the children, they got no partner to support them. But you got to have a good partner.
That is.
You've got to have a good partner. You really have. because you're a changed person. You're not the person you were before this dreadful thing.
No. What would you say about that? How would you rate your quality of life overall now?
Well, I think it's very good, because the biggest setback in the illness was not eating. I could never eat anything. I mean, to go out for a meal, it was horrible, because I had to refuse this, refuse that. And of course, people that can eat can't think you're a fussy eater. I think, God, Joyce, you've got to have something. And it's hard to explain. I just can't eat it. So that's a big, big bonus, being able to eat.
Yes,
so
a big improvement.
Oh, God, I mean, my life changed completely.
You were saying there that you don't necessarily feel the same person. I mean, there are perhaps pros and cons, but overall, psychologically, how do you feel having lived with the cancer and apparently beaten it effectively, as far as we can tell at the current time?
Yeah. Well, I think I'm living well with it. As I say, it's just the odd times that it comes back, and I think it'll always be there. I mean, like I say, you get a friend with it. I mean, I had a friend ring me the other day. She'd had the cancer of the blood. It's come back, Joyce. You're the only one I can talk to, you know, and it really hit me hard, you know. I thought, oh dear, what a shame, because she's a lovely, lovely person.
But still, people are relying on you, and that's a positive as well.
Yes, because Glenys said, I can talk to you, Joyce, because she said, you know, you're calm and you understand. And I think this is the main thing. When you've been through it, you do understand.
Yes.
Although, I mean, I can't put myself in Glenys's shoes, it coming back.
Yeah.
I mean, that must be terrible, terrible for her, but...
How much do you worry about the future for you, personally?
Well, I think, although, you know, it's gone, as far as Dr. Barry's concerned, you do still worry. You do think, oh, is it going to pop up somewhere else? But that's why the support group is such a good support, because you get these little twinges and various things happen. You think, oh dear, why is that happening? Then, as I say, you've got some brave person stand up and say, you know, I had stomach cancer and this has happened. Oh, you've got that for the rest of your life. Dr. Barry. So you come out feeling very refreshed and, you know... So they're not a waste of time, even though you've got over your cancer. They're not a waste of time. They're wonderful.
That's good to hear. If you imagine a viewer watching this now who's maybe newly diagnosed, they're hearing your account, is there anything you'd want to say to them here, you know, knowing that they've got to go through quite a few steps?
I don't know, because I think it's, in some respects, it's a very private thing. Very private. And... as I say, the word cancer, I think it destroys everyone. And I think you've got to do what I do. You've got to change its name, because it's just horrible, horrible, horrible word.
Or perhaps take a different view of having that condition. Like, you changing the name, it actually facilitated you looking on the light side of it. You know, treating it not just with a fear, but almost like you could face it then. You could face it and almost make light of it when you need to.
Yes, yes.
So in other words, it was a good coping strategy.
Yes, yes. You have to. Like I say with Emily, I mean, to don a wig on every day, and it was, God, it was so hot. It was the last hot summer we had. But you just had to look on her. She was your lifesaver, you know. She's part and parcel of you getting better, because eventually that hair's going to grow again. So... you do just have to cope with it, and as I say, make light of it. It's no good sitting there, everything doom and gloom.
Well, Joyce, you've come a long way in the last few years, and you've had your complications, haven't you, with the setbacks initially, particularly when they told you from that stage when it was inoperable through to the 11th hour operation, and then, you know, that vomiting and all those weight loss and the appetite restriction and the food issues as well. There's a lot of issues there that are important to put on record so that other people can hear, you know, what you've come through. The bottom line is you've come through all of those, and really very well, and arguably better than that period just before the diagnosis. You really seem like a new person in a way.
Definitely.
I want to thank you for coming in and sharing your story. I know everybody will feel it's definitely a valuable and inspirational account, and I wish you all the best for the future. So thanks again for sharing that with us.
Thank you very much. Thank you.